Welcome, everybody. I'm Michael Sinclair, Executive Director of the Harvard Ministerial Leadership Program, and we are very pleased today to be co-hosting this event with the United Nations Economic Commission for Africa. And I'm glad to have with us Dr. Bartholomew Amar, who is Director of Governance and Macroeconomics at UNECA. Dr. Amar has taken on the very important task of being rapporteur. So he will provide us with a summary and key takeaways, key action items in the last 5 minutes of the discussion. The primary purpose of this conversation today is to focus on practical steps government ministers should be taking now to prepare for the rollout of a national COVID vaccine program once vaccines become available. And most importantly, to be able to sustain such a national program for as considerable time, with sufficient time, to ensure that a sufficient proportion of the vulnerable population is vaccinated. Now, we're all very well aware that there is a very important effort going on internationally to ensure more equitable distribution of vaccines. And there are platforms much more influential than this one pursuing that important goal. So we're not going to focus primarily on that goal in our conversation today. We are extremely delighted and honored to have lead us in the conversation today, Her Excellency Ellen Johnson Sirleaf, our Coll-Seck, Minister of State of Senegal, former 2 times Health Minister of Senegal, and Cristina Duarte, UN Africa Advisor and former Minister of Finance of Cabo Verde. Earlier today, we heard from Dr. Tedros Ghebreyesus, Director General of the World Health Organization, Dr. Mohamed Pate, Director of Global Health of the World Bank, and Dr. Vera Songwe, Executive Director of UNECA. And we're going to share with you now a recorded version of their remarks, and we'll pick up the conversation on the other side.
Excellencies, members of the Harvard Ministerial Leadership Program Advisory Board, dear colleagues and friends, I thank you for the chance to address this important event, and I would like to acknowledge the support of my brothers and sisters at the United Nations Economic Commission for Africa and the World Bank. Organizing the effective and rapid delivery of COVID-19 vaccines is critical for the world, especially Africa. WHO has stood shoulder to shoulder with all its member states during the pandemic, providing extensive guidance and resources to fight COVID-19. And we will continue to do so. But ultimately, countries must prioritize their own COVID response, including vaccine rollout. This is the essential ingredient to helping their economies and societies to respond and recover quickly and effectively. Early on, countries across Africa reported considerably lower numbers of cases compared to many in the Americas and Europe. But as the pandemic has continued and new variants emerged, we have seen countries across the continent face increasing transmission and economic strain. To address this, 3 steps must be taken to protect the health and economic well-being of African countries: a commitment to equity, preparedness, and whole-of-government action. First, equitable access to vaccines was the end game that WHO had in sight when we launched last April the Access to COVID-19 Tools Accelerator, with the President of the European Commission and France and the Bill and Melinda Gates Foundation. This historic initiative has in just 9 months initiated 3 lines of defense against COVID-19. the research development and rollout of vaccines as part of COVAX, rapid diagnostic tests, and treatments that prevent severe illness from the disease. But to succeed, all governments and manufacturers must commit to equity in providing access to vaccines and other tools to at-risk people in all countries, including Africa. Sadly, we see around the world today a great divide between those with access and those without. Not surprisingly, countries in Africa are among those who have so far been unable to start rolling out vaccines. This is where the ACT Accelerator comes in. It's working to ensure all people at risk in all countries benefit. This brings me to my second point. To support the ACT Accelerator's work, countries must be prepared to receive vaccines. We aim to start vaccinating in February and vaccinate 40 million people by March, prioritizing health workers and older people. But to get shots in arms, all countries receiving vaccines under COVAX need a national vaccination plan. To support this, WHO has developed the Vaccine Introduction Readiness Assessment Tool to help countries better coordinate, manage, and monitor the safe introduction of vaccines. A key part of this is vaccine regulation. Countries need to confirm the regulatory pathway for licensing the vaccine and secure approvals and waivers for imports to ensure they are ready 2 weeks before the vaccine is shipped. Demand generation is also key. The tool puts particular focus on generating confidence and trust in COVID-19 vaccines, thus stimulating demand. On average, the African nations are 42% ready for mass vaccination campaigns, which is an improvement on the starting point of 33% 2 months ago. We're working hard to help countries reach 80%. Thirdly, to ensure the building blocks are in place, whole government action is essential. We're calling for national committees to be established to streamline coordination, oversee preparations for immunization, and ensure all logistics are in place. During the pandemic, political leadership and vision in many countries have guided action to protect populations and economies at large. This must be intensified in 2021. In closing, I would like to thank the Harvard Ministerial Leadership Program for prioritizing such principles in its work with my ministerial colleagues. I also salute the ministers for their commitment to supporting their citizens. By prioritizing the health and safety of your populations, you're putting your countries on the fastest track to overcoming the societal and economic challenges faced by COVID-19. I thank you.
I think first and foremost, the vaccines are coming. That's good news. I'll ensure that everyone is aware that the prescription remains mask, hand washing, physical distancing, ventilation, as well as safe and efficacious vaccines when they become available. To anticipate and deliver the vaccines effectively, however, the first thing I will do is to get organized, to organize a platform that is multi-stakeholder, that is inclusive with different partners in government, to assess the readiness of the country in terms of being able to deliver. So in terms of the regulatory aspect, what it needs to do, the needs, the financing that will be available, the infrastructure requirement, including the cold chain infrastructure that is needed, the human resources, all that assessment to be done in a very rigorous way, including the information system, as well as how to engage the communities ultimately that will be critical to successful delivery of the vaccines. After that assessment is done with the support of that platform that we've organized, then craft a policy in an inclusive manner to decide who gets what, when, in a very inclusive way, in a very transparent way, with an intentional focus on the most vulnerable in society and those who have the greatest burden of this pandemic on their shoulders to ensure that they are protected. And then really get the ministers of finance and planning to bring up the resources, and then on the technical and operational side, be sure that the plan that we craft, the deployment plan that is crafted, is tested even before the vaccines arrive, so that we take simulations to really check how would we be able to deliver that. That would be how I would proceed in terms of getting ready to deploy the vaccines if I were in the position to contribute in that way at this point.
I think on the financing of vaccines, we have now a sort of three-track process. There is the COVAX facility where the COVAX is going to raise some resources for low-income countries. We have 9 countries on the continent that are not part of the sort of COVAX facility, even if they've put their names on the list because they want to be part of the sort of more, I think it's more of an insurance system, because then whatever the vaccines come out first, they can get access to those vaccines. Then we have the low-income countries where COVAX is going to provide somewhere in the order of 20% of the vaccine needs. And what we are also working on, again, with Afri-Exim Bank, EcoNet, the President Cyril Ramaphosa has put together the African Vaccines Task Force, African Vaccines Acquisition Task Force, AVAT. And there we're looking at seeing whether Africans themselves can raise resources, probably either through sort of letters of credit, but whether we can borrow forward to be able to purchase the vaccines today and then see whether we pay later. And so really we're working with Afri-Exim Bank. We're hoping maybe that the SDRs, the special drawing rights from the IMF, will also be able to help us. Of course, COVAX is doing 20%. We know that to get to herd immunity, you need somewhere in the order of 70%. So there is still a huge gap between COVAX still needs funding even to the fixed 20%. As we speak, we have been able to secure under the AVAT, this African Vaccines Acquisition Task Force chaired by Strife Masiwia and with EcoBank and Afri-Exim, working to see whether we can purchase about 270 million, which cost about $1.6 billion. So 270 million vials of the vaccine for a total cost of over $1.6 billion. What we are looking at is to see, of course, as you know, we've had this debt service suspension initiative. To date, it has delivered about somewhere in the order of $6 billion to the continent for 2020. For 2021, we're starting a new cycle. We're hoping that maybe some of the resources that countries get from the DSSI savings, because it's an immediate savings. This is money that they would have otherwise used to pay their interest payments. And countries usually have this budgeted for very clearly. Can they put some of that aside to for vaccine acquisition? So that's the first part. The second part is looking whether we can recapitalize, national development banks. The French under the African, French IFD have launched this initiative called Finance en Commun, where they are strengthening local banks. And one of the things is working exactly with Afri-Exim Bank, regional banks like that, to see whether they can provide some advanced purchasing agreements so that countries can get the vaccines. The vaccines are going to be the only way we open our economies. So this is an investment into the future. This is an investment into reopening the economy. This is an investment that we believe has to be done today. And so any resources that countries have, we are supposing that Ministers of Health and Ministers of Finance should speak together. In particular, we also need Ministers of Education, because people need to be educated on the vaccines and why people should take the vaccine, but that they should work together quickly to get those vaccines, as you say, in the United States, into the arms of everybody.
Well, we have, late last year, 2-3 months ago, we initiated together with WHO, UNICEF, Gavi, and ourselves, an effort to get 100 countries ready within 100 days. Well, within 2 months, we've already reached 96 countries finishing their assessments. We have a sense of their readiness. It appears that there are certain areas of gaps, particularly on planning, coordination and management of the vaccine rollout that needs to be strengthened in some countries. But I think the process has started in many of the countries in Africa and also outside Africa. The cold chain infrastructure, we've assessed it. I think that assessment is, the detail of it is still being analyzed, but we have seen that for up to 5% of the populations, perhaps the cold chain infrastructure, the normal cold chain can accommodate some of the vaccines, not the ultra cold chain equipment that is needed for the Pfizer vaccine. But beyond that, the cold chain infrastructure needs to be strengthened. The logistical system is also something that needs a lot of thinking through, as we have seen even here in the United States. And then the regulatory side also is something that needed a lot more attention. So there are certain areas that have emerged, including the training of the human resources, the health workers themselves, in terms of how they can be able to get the vaccines or deliver the vaccines, and the information system. In many places, we've seen that the targeting of the population itself, the system to be able to track who gets what, when, and to be able to get them back. This is the time to fix those before the vaccines start being delivered. As we have seen in the advanced economies, it's not an easy task when it starts, but it needs to happen.
Well, so I would first like to invite our online participants to submit their questions through the Q&A feature on your screen. We will curate them and try and ask as many of them as possible. Excellency, if I may, I would like to start with you. Both Dr. Tedros and Dr. Pate alluded to the importance of a whole government approach, a whole government strategy for vaccine rollout. My question is, number one, do you agree with that? A whole government strategy is necessary. And secondly, assuming you do agree, how practically should that be organized? For example, who leads it? What is the role of ministers other than the health minister, and so on?
Well, thank you for your...
Sorry, that was to Ellen Johnson. Excellent.
I don't know. Okay.
Ellen, can you hear me?
Yes, I do hear you. Yes, I'm fine. Yes, I do agree on a all government approach. You cannot deliver vaccines to the population unless there's coordination among those entities, the ministries that have the responsibility for the response. The Minister of Health, of course, takes the lead in collaboration with the Minister of Finance and, as Vera pointed out, Ministry of Education to inform the citizens on how this is being distributed and show them that equity is taking place. On the containment of a virus, we, by experience, have ensured that we have a management incident system that is headed by the president. The president is able to bring all those players together and make sure that they have a coordinated approach. Delivery of vaccine, you may see an incidents team headed jointly by the Minister of Health and the Minister of Finance, the two key players in this regard. But they must also ensure that while they have their regular meetings to coordinate and to ensure progress, to tackle any issues, whether it's of equity or whether it's delivery, whether it's finance, ensure that their regular meetings are also upgraded to the presidential level so that the president has an opportunity on a regular basis to assess the progress to make sure that it's going well. And I will just mention one thing. In all of this, people's confidence is a major factor. Unless people know of the vaccine, know of its results, its processes, and difficulty can come even when there's availability, because they don't understand and they get all kinds of suspicions about side effects. There's a lot of rumors, and if they don't have the right information of assurance, that also could undermine the effectiveness of the delivery system.
So with that in mind, Excellency, who do you think should be the trusted voice of government on this matter? Is it the health minister? Is it the head of state?
Oh, when it comes to ensuring confidence, the head of state has responsibility. The head of state has to get out there and show the public that this is something that is for their own good, and show them when it comes to the details of delivery that can follow. But the voice of assurance must come from the head of state.
So turning now to the issue of the health system. Most African health systems were struggling well before COVID. Now they've had to deal with COVID care and treatment, and even in countries where the reported infection rates have been relatively low, the health systems are under extreme stress. Now we're asking them on top of this to load up a national vaccination program. Can you talk as a former health minister about how a health system would prepare to do that? How would you reorient the infrastructure, the logistics, the human resources, all of which right now is going into treatment and care towards a vaccination program?
This is a very tough question, because this is a real life, and Ministry of Health will have to prioritize, but also for the health system, it will be important to know that vaccination is not something new for the health system. People need to build on what was done before. For example, for the immunization programs existing already, but also from what we have learned from the example of Ebola. We have seen, and His Excellency President Sirleaf can say something very clear on that, because when people went to do immunization of people in Sierra Leone or Liberia, it was at the time of a crisis. But it's up to, in fact, the head of state, the Minister of Health, to mobilize the team, but also help them to ensure that they are protected. They need to have equipment. They need to ensure that all the barrier measures are there, and they will just do their job because they used to do that, but they will not be sufficient. This will not be sufficient. And what is important also is the issue of task shifting. People from the Ministry of Health already, who are not involved in immunization, but not also involved sometimes in the treatment of patients, can be used to be involved in the immunizations campaign. But also people from other ministry. I would like to take the example of Ministry of Education, where you can have schools use because of logistical reasons, and the teachers can be used, for example, to fill all the documents, to orient the people, etc., etc. Donc the health system, to summarize, is already in a difficult situation, but we can, based on our experience, based on the issue of taking all the potential in the other ministries, and also based on really reinforcing the human resources existing through, for example, task shifting.
So one question that has come up is related to this, your suggestion of task shifting is upskilling some of the professionals, particularly referring to the fact that most African countries have fairly significant numbers of community health workers. And oftentimes the community health workers are very skilled at community level preventative health, but they're not necessarily equipped to be able to do vaccinations, for example. Would you suggest to countries that this may be the time when they begin to professionalize community health workers?
In fact, task shifting is not doing bad prestation for people. It's not because you do, the task shifting need to be organized. And we have seen a lot of community health workers who are already trained to do vaccination. And they need to be used and need to be to have more skills if necessary, more training, etc. And this is important because if not, you will have shortage on people who can be involved in the immunization campaign. And we need to look at everything, but if training is necessary to do that, if you need to have other people from the other sectors, you need also to take them on board. Like militaries, you have a lot of health structure where you have militaries, but they are not often used for the immunization campaign because they are in the army, etc. These people can be taken on board. So I think that we need to have a lot of imagination and try to have quality, if necessary, training, but the only people who used to do immunization cannot be the only one in charge.
And just one last follow-up on this issue, the question of motivation. You know, health workers now for more than a year have been on the front line of this pandemic, and I have no doubt that they're exhausted. And now, you know, there's this additional responsibility coming on. You know, how does one motivate an exhausted workforce to tackle a new challenge of this kind?
You see, in a lot of countries at this stage, before we start the vaccination, you have a lot of movement on the trade unions of people who are part of the health system. And we understand very well that they have to be motivated. Some of them are just asking for more support on their protections because they don't have any more, sometimes not a lot of masks, they don't have all the equipment, and Ministry of Health and Finance and head of state need to understand that. It's not normal that because you are a health worker, you are exposed to be sick and to die. So this is very important to have equipment. The other thing is to be paid, because some of the people in some countries, you have take, for example, doctors who have not job at this time because the country is not able, for example, to give them contract, and they have been given contract, but at a moment they were not paid. They went also on strike and say, if we are not paid, they need to have regular paid. They cannot be 1 month you are paid, another month you are not. And also other type of motivation, like you will have to have more time in the days than you used to do. And you need to have also some supporting financial resources put there. It is why when we are speaking on COVAX and others coming with vaccine, it's not the only resources we need. We need the vaccine, but we need to put resources. It is where the Ministry of Finance is coming on board. We need to have resources also to pay all the other expensive things, including motivate the health workers.
Yes, so Cristina, this is the big question, is the financing. Every country in the world has suffered dramatic economic downturns over the past year. Fiscal space is extremely limited. Countries are expected to procure vaccines because the global platforms are only likely to deliver something like 20%. So procuring vaccines is one dimension of it, but the other, which is a much longer and sustained investment, is the delivery of vaccines. And how do you finance that? And how do you do that in a way that you don't ruin the rest of the health system, so that the rest of the health system has no budget and people are dying from other diseases other than COVID for lack of care?
Thank you, Michael. Good morning to everybody. It's with a great pleasure that I participate in this event, and I have a great pleasure to see again Ellen again. Michael, allow me, before jumping to these budget financing issues, allow me to, in a very quick way, to list what a Minister of Finance should do to address the budget challenges. Because to find more resources to address these challenges, before going to budget mechanics, reallocation of resources, you need to prepare the ground. This is not a crunch number exercise. And based on my experience, I believe that Minister of Finance and Planning have a coaching responsibility in the government and public administration, because we do have a cut-crossing nature function. And the nature of our function in terms of being cut-crossing function gives us this coaching responsibility. It's not an option. It comes with, let's say, with the terms of reference, with the job description of a Minister of Finance. For example, it's out when a government, a country is facing a challenge like this, or in the case of Cape Verde, when we faced dengue, it was my responsibility as Minister of Finance and Planning, exercising my cut-crossing responsibility, to design the log frame of the challenge, to promote policy coordination and integration first. This is the first step. In the case of Cape Verde, and this is my second comment, Michael, I had the right institutional tool to do that. Because as Minister of Finance and Planning, I had in each ministry a unit, a finance and planning unit, that report hierarchical to the sectoral minister, but functional to me. Functional, that unit in the Ministry of Health, the Planning and Finance unit in the Ministry of Health, in the Ministry of Education, used to report to me. The third comment that I would like to make at a government level, when facing these situations, my first move was to team up with the owner of the business directly affected by the challenge. In this case, I team up, in the case of dengue, I team up with the Minister of Health. The Minister of Finance and the sectoral minister that is in the front line to face the challenge, we need to come up with a team. And once we come up with a team, we need to come up with a plan. And the first step is to prepare government's mindset that this is an extraordinary challenge for extraordinary solutions. And once the government is all connected to the same page, to the same ground, then I'm in a position to assume my responsibility in the picture, getting more money to face the challenge. But I need to feel that every and each ministry in the government feels that this is an extraordinary challenge and, of course, requests extraordinary solutions. Because I will be bringing, as I did in the past for dengue, I brought to the Council of Ministers extraordinary solutions that would involve each and sectoral budget, such as taking money for one sector to put in the other sector. So what I did in terms of getting more money, first, I told to my team, when searching for additional resources to face vaccines, dengue, Zika, or any else issue, we need to have a broad concept of resources. Resources, Michael, are not only money. We need to have an integrated concept of resources. Money, additional financial resources, is just one. Second step is to try to identify idle resources and idle assets. It's important. And when you identify idle assets, then you need to involve the private sector. You need to involve the civil society. So encourage asset sharing is an important part of the equation. Fourth, in the case of Cape Verde, usually I had in the budget a quite significant amount to face contingent situations. Because in the short term, to address a challenge in the short term, you have to do it first with your own resources. Because it takes time to mobilize external financial resources. And during that gap time that you submit a project proposal, you issue an emergency need request, you need to have money in your budget to address the situation in the very short term, your own resources. So what I do, every budget in Cape Verde, I had a hidden, literally, Michael, a hidden amount. Only me and the Prime Minister knew that that money was there. Nobody else. So when the crisis hit the Cape Verde and I start just financing very urgent activities, people was a little bit concerned. Fifth, what I did, to get money to face additional challenge, don't go to the revenue side of the budget first. It takes time. It takes time. Go to the expenditure sides of your budget. This is the fast way to get money. Look for, let's say, less efficient expenditures. I will give you an example. I went to the education budgets, and through an ICT tool that has been produced in less than a week, I managed to find every and each ghost teacher in the budget. I managed to find every and each ghost nurse in the budget. So I pull out all this waste money, what we call fat. Your first step is go to the expenditure side, clean it. Your second step is revenue. Then you go to the revenue side, how to get additional resources. Then I need to tell you, the ratio is more or less this one. For each dollar, you need to mobilize more or less $9. This is the ratio, 10% to 90%. And what I did, basically, since I had Cape Verde has quite strong country systems, so enjoy some credibility based on transparency, what I did, I would put the $1 up front, advocating that I have strong country systems, transparency, and I was able to mobilize the remaining $99 with a very low interest rate, 1.4, a very good grace period, 10 years and 24 years of maturity. So basically, this is what I did in the short term.
All right.
Sorry.
So we need to, we don't have a lot of time, as you know, so we need to tackle some of the questions that are popping up. And one question that has been put forward by a number of our online participants, Excellency, is this issue of equitable access. For example, in some countries, the political elites and so on have been front of the line to get vaccinated. So that's one issue in itself. But the general question of how to ensure that there is equitable distribution across all populations, not just in the better educated in urban centers. When you were running the Ebola prevention and treatment campaign in Liberia, how did that roll out?
When it comes to the equity issue, I think ensuring that you have a proper targeted regime. I believe all of our countries have now resolved to the fact that in that regime, frontline workers, healthcare workers have primary attention. They get the first. Elderly people, disadvantaged people are those who follow the queue. There may be, what you call high value person would probably be the president, the vice president, maybe the first layer of government, about 5 or 10 people, because they have responsibility, can also be put in the queue with a certain amount of prominence. But in our case of Ebola, where we were dealing with containment, that did not become the issue. The issue on that was to ensure that the responsibility was with the communities, and the communities made the decision as long as they follow the national agenda and national priorities. And they made the decision, they took responsibility, and they got the support that they needed to be able to have effective implementation. But we're going to face a lot of problems on this equity issue because, first of all, the equity among nations is an issue. 20% on COVAX for Africa is not enough. And then the equity issue within nations. And even though we say there is a targeted regime that must be put into a place that's very clear, it still is a question of everyone wanting to save lives. And so they're going to be misuse, not full adherence to the regime, where people are going to cheat, to put it carefully, because they want to make sure that their own families and their own associations, their own groupings are protected. That's where the government will have to come in. Through this management team on this, they have to be very clear and follow through monitoring what's happening, getting regular reports. In our countries, the capacity can sometimes be difficult. Reaching people through underdeveloped infrastructure is an area. How do we do that? There you have to look at local government authority. You have to be able to strengthen them for them to deliver in those rural areas and follow through with the monitoring of those are responsibility, Ministry of Health, of course, where the General Services Agency, they have responsibility for things like that, ensure that they have prepared themselves properly to do that and will be monitored by the ministries concerned and ultimately by the president, who must go back to the public regularly and timely, telling them how it's happening, what's working, where it's going wrong, and where adjustments, need to be made, and admitting to where we need shortcomings and gaps and telling them what action is taken to fill those gaps. There are two things that we leave you all with. One is confidence, building the confidence to get this program through. Second is recognition. Those who have the prime responsibilities are left in the shadows. And at the end of the day, delivery to a poor rural family in an area that has no infrastructure depends on the passion of that community health worker who is so committed because you've given them the incentive, not only of the supplies and the money, but the recognition of the role they play.
Yeah. To Her Excellency's point about the need to be able to monitor, many countries do not have strong data tracking systems. Their health information systems are often weak and sometimes non-existent. And so what would you suggest? How do countries maintain transparency on who is getting the vaccines, who is accessing the vaccines, and so that they themselves can track, but also so that the public can be aware?
I would like to say that we need to have, at the level of the Ministry of Health, National Immunization Technical Advisory Group with a scientific committee to look at prioritization. As soon as we put politics inside, this can be really a mistake, because people will not trust anymore the system. So we need to base the prioritization on what has been developed when you look at the data and the data of epidemiology. Who is the frontline people? Who are the ages where COVID-19 is becoming very intense and where you have the most people dying? Everybody knows that today it's the elderly people, it's the people with comorbidity, is the frontline, is the health sector, the health people, but also you have, because of containment issues, you have more and more policemen or militaries who are also at the front line. So this needs to be scientifically documented. And now I can tell you also that everybody is often saying that the health system is weak, we don't have enough data, but I can tell you that more and more in countries, you have the DHS really in place, where you have everything coming from the bottom to the level where you are collecting and analyzing. This we have been supported by Minister of Finance in countries to be able to do that, but also by partners. And I think that it is not anymore an excuse, and people need to, if it is not strengthened already, need to strengthen the surveillance system. And this is why I think that now more and more we can trust everything coming from the data from a lot of ministries. If you look at immunization of children, you have real data, you have real figures. It's not something people can say anymore that it is not good or it has not. This is coming to the center of the ministry. And let me say something, I can?
Yes.
On the issue of equity, I wanted to say that I like, again, like as usual, the response of Madam President, just to say that sometimes you will need to, this need to be looked like a problem of equity when you have decision makers who are taken in front. This is sometimes more because the community is not trusting sometimes the vaccine. And you need to take people they can recognize, they know that if they do that, it is that the vaccine is good. This is something I wanted to say. And the issue of equity is not only at country level, but it is also at international level today. And this is not the point of our discussion, but it is very important to say that the issue of equity needs to be also at international level.
Absolutely. Excellency, I'd like to come to you with our last question before we go to Dr. Amar for the summary. The question, Excellency, is vaccines are seen to be, in some senses, the panacea. They're going to unlock economic recovery globally and in countries across the world. Clearly, vaccines in themselves are not going to be the complete resolution to economic resuscitation in most countries. What else should governments be doing to be able to ramp up economic recovery as they are beginning to roll out vaccines?
Stimulate the private sector. I believe that the vaccine, of course, is absolutely important. If people are not healthy, they cannot work. If there's no work, the economy will continue to falter. But I think I was so glad to know that under the accelerator, Act Accelerator, it brought the public sector into it. That brings the public sector into the health system where they have not played a large role traditionally. We now need to get them not only to support health systems where some recovery program regime is organized and designed, but also to get them to now ensure that investments that are already in place continue. We don't get the fear factor that causes operational investment to stop, that there's no fear factor to ensure that we are able to attract additional investment to grow the private sector. In today's world, the greatest momentum in our country for the economy will be the private sector. Official aid will dwindle. The support we know of in the past will not be there as it was until our private sector, both our own national private sector systems that are in place and can be expanded, but also through regional integration and cooperation, being able to expand and bring them much more into the economic life.
Thank you. So, Dr. Amar, you have heard the discussion. Can you give us shortly our takeaway message?
Well, what I'm going to do is to sort of give a brief summary and highlight the key messages within the context of that summary. The discussions have revolved around 4 broad areas of the vaccination rollout. One is equity. How do we ensure this equitable access to the vaccines? The second is preparedness. How do governments get ready to roll out these vaccines in a way that is effective and equitable? And the third is whole for government, the role of government in this process. And a cross-cutting issue here has been financing. Now, the discussions have shown that equity and preparedness are linked to a whole of government approach. And so while these areas appear to be distinct, they are actually interrelated. On the equity, the key message here is the need for a communication strategy that ensures that all interested parties are aware of the vaccination process and how it's being rolled out. The second is targeting and prioritization, particularly a targeting and prioritization regime that is effectively communicated and everybody's aware of that. And the third is the need to involve communities in this whole rollout process. On the preparedness, the key message here is the need to really repurpose existing infrastructure and human resources to address the vaccination issue, because there are systems that are available that need to be leveraged. On the whole of government, the key message here is the need for coordination, particularly intersectoral coordination, bringing together finance, health, and education ministries, and also to involve the private sector. On the financing, which is a cross-cutting issue, the key message here is to adopt an integrated approach to financing that is cross-sectorial and prioritizes domestic resources, particularly in the short term. Now, there are several other messages that came up here, but these are the key ones that I'd like to highlight at this moment. Thank you.
That's very helpful. We obviously need a great deal more time to get into more detail on this, and we have many questions from our online participants that we were not able to get to. But I really thank you profoundly, all of you, for your contributions, and we look forward to continuing the discussion. Thank you very much.